We have another email, this time from Lisa in South Miami. And she writes, I just watched your segment on the tie between undiagnosed autism and drug addiction and can say it does happen. We saw signs in my teenager that we honestly hoped and prayed that was nothing. I wish we treated them at the time. My son is now in rehab, but thankfully he's alive. Just wanted to share so other families won't make the same mistake. Thank you so much, Lisa. That is really great news. Suzette, we are so glad to hear that Lisa's son is on the up and up. And the undiagnosed autism and drug addiction, we can say that it does happen. And did you see the signs in your teenager?
So I did see some of the signs. My daughter doesn't have an autism disorder. I do have a son who's mildly autistic, though, and I did see some early on, when preteen, see some anxiety in him. I did get him help. That's the good news, and he's now very well integrated with his peers, and he's getting ready to prepare for college. But going back to that with my daughter, I did see some signs of her mental health deteriorating as she was in her mid-teens and later years. As it relates to autism, it's very important to pay attention to the signs, and I do agree with Dr. Loyd that it is a missed opportunity for us.
And how can caregivers get support?
So, good news is that there is more and more support. There's growing support, especially here in South Florida. For instance, there's FAU has a center for autism disorder. There is a lot of providers out in the community that are starting to specialize in those areas. It's also important for not just the treatment of the mental health and the substance use, but also the treatment of the autism disorder in terms of learning to read social cues and understanding them so they can start to feel more comfortable, understanding how to deal with their sensory issues as well, to help them, that should be part of their treatment plan and be integrated into their treatment plan so that they can really have a more holistic approach. I do agree with you in terms of that holistic approach to their treatment and recovery.
Dr. Loyd, I see you shaking your head. Let us know what you're thinking.
Well, first of all, I love my peers, so thank you. It is a comprehensive approach, and I'd be interested to see what my peers think about this. But we have this idea that we can somehow separate addiction out from all this stuff and treat it in a vacuum. And I'm telling you that won't work. I've never seen it work. And it doesn't work over the long term. So our approach does need to be comprehensive in taking into account, underlying autism that may or may not be diagnosed, underlying mental health issues that may or may not and are often not diagnosed. So I couldn't agree more with the approach. And I think that we need to get away from this idea that we send somebody away for X amount of time and teach them how to not use drugs. Well, that's not how this works. And even medication-assisted treatment isn't like that. I mean, it's a very valuable tool. It saves lives, and I think we're all in support of it, although we still have to battle it, in the outside world, the stigma around it. But at the same time, it needs to be a comprehensive approach around that, because we need to be talking about, housing situation. We need to talk about access to job, IDs. You got a felony on your record, what that means for trying to secure a future going forward. So the approach has to be comprehensive, and we need to be talking about a recovery-oriented system of care that takes all of these factors into account. And I'm going to say something really bad now, which is we need to be looking at insurance reimbursement models that allows for this treatment process to happen instead of letting kids die.
So
Yes,
Dr. Lewis,
100%.
Dr. Lewis, I
100%.
want to come to you
Yes.
as you have young children.
Yes.
And other families think about their kids being labeled. But how can getting early help the families?
Definitely, that's a great question. So I have 3 young children, all below the age of 13. And essentially, as parents, there are times you may feel handicapped, or there are times you may feel, oh, you're experiencing this situation by yourself. Right. However, there are resources available if you speak up. So the key aspect is speak up and ask questions and inquire regarding situations where children are behaving in a particular way. Were there any triggers? Were there any other examples where the child felt anxious? Because labeling is an issue. It's our societal issue. It's a global issue. Yes. And what we need to do as parents is to collaborate with healthcare professionals, collaborate with learning specialists at various schools, as well as the teacher. The teacher may say, you know what, during this particular activity, your child becomes more anxious or tries to behave in a particular way that does not follow the school rules. And how can we work as a team? Not pointing fingers and labeling, but work as a team to create a strategic plan to prevent some complications that could happen later on in their life.
That does change the trajectory, because you know, through collaboration with my son's school, I was able to get him the help that he needed through social interventions.
Wow, wow, thank you.
So I don't have that perfect segue, but there's one thing that we've been talking about quite a bit is medication-assisted treatment and stigma. And I think there's a real push to change the way that we describe it because of that stigma. So the term medication-assisted treatment suggests that a medication isn't itself a treatment, but it is. And so there's a real push to describe it as a medication for opioid use disorder, for instance. And I think when you're talking about taking a holistic approach and trying to show someone that it's okay to seek treatment, I think even just that small change can make a really big difference.